gives me great pleasure now to introduce Phil Hull from the New South Wales Cancer Council, and he's involved with the Tackling Tobacco project. Do you want to show us your show and tell first?
Yes, I do bring my show and tell.
Just show us those and what they are.
So this is a hot off the press poster that we've developed, and I think it's talking about that message that we can do it for consumers. So hope everyone can see. So this is a consumer called Gay, and she's living with schizophrenia, and we turned her into our poster girl because she has quit smoking for 2 years. And there's a quote on there which is probably hard to read at the back. It says, "Quitting smoking felt like getting out of jail." And that was Gay's quote. And Gay's, I think it's fair to say, experienced a lot of benefits from quitting smoking. She's had significantly more money in her pocket. That's helped improve her lifestyle. It's improved her self-esteem. And she's actually just had a hip replacement operation, which was why she's in the chair. And her workers tell me that the smoking's really inspired her, being able to quit smoking, to persist in the physiotherapy, and she really believes that she'll be able to walk again well because she's taking some of that mental power that she, and the sense of empowerment she gained from quitting smoking at the time.
Just because last time I was at a forum all about tackling tobacco, one of your poster consumers was actually present. And I just wonder if you can just talk a little bit about him, because he had an enormous impact on a gathering of professionals who were all there trying to assist people to stop smoking. Can you tell us about this gentleman?
This is Vic. Look, and I should say that the consumers are very much involved as volunteers to help us in this project and have given them permission to talk about the stories. So Vic's, well, as he said there, I've got an extra $70 a week in my pocket, which has made a great difference to him. He's been through drug and alcohol treatment programs, and he currently volunteers trying to help people in drug and alcohol recovery. And his story is that when he went through drug and alcohol treatment, he was really told, don't worry about smoking, it's not a real proper drug, don't worry about that. Anyway, Vic's had very serious heart disease, he's had to be helicoptered, he's had heart surgery, and he went into his service. We funded some nicotine replacement therapy at a clinic he attends, and he went in, and one day they said to him, would you like to quit smoking? We've got some free patches and gum, how about you join in? And he did, and he's been able to quit smoking since then. And he's a passionate advocate for integrating quitting smoking assistance into drug and alcohol treatment now, and is...
I mean, that's putting it bluntly. I mean, he really is outraged that so many service systems make no mention of tobacco when he knows it's the thing that's going to chop 20 years off his life, and that he is now just saying, for God's sake, all services should have a fundamental commitment to assisting people to stop smoking. And there was a very lively debate there about whether indeed health professionals who are involved with clients who are smoking should themselves be addressing the smoking issue. Can you be effective assisting someone else with giving up smoking, or indeed dealing with weight, if you yourself do not address it? We know, for example, that nurses have a very high weight problem with overweight. This was hot in the room, I can tell you. What's your own view when it comes to tackling tobacco as a lifesaver? Do you think health professionals and NGO staff have a responsibility to address it as a staff issue as well as a client issue?
Look, I think that's a tricky one. We did have Graham in the room there, and he's a smoker, and he's really on board with the program. And in fact, you know, all the clients have been saying, come on Graham, get with the program.
Graham's working with fathers in Campbelltown on parenting, still smoking, even though the fathers wanted help from him to give up smoking.
So in my experience, I think it depends on the attitude of the worker. I think if the smoking is kind of dampening down their enthusiasm because they're a smoker and they just, you know, think this is all too much, then that can have a negative impact. But I think there are many other workers who are smokers who actually can give effective assistance.
Let's explain, and perhaps you have another slide you want to show us, why this is connected to the physical health of people with long-term mental illness. Why are we talking about tobacco?
I'm conscious about the impact, and I mean, I think these slides probably are impactful. But yeah, I think these deliver the key message for us. So down at the very bottom column, if you can't read, that's the general population smoking rate in Australia.
If you would just move to the side.
Sorry.
Yeah.
Good point. Which is about 18%. And then these are figures for smoking rates with various conditions of disadvantage, and that's what our program is concerned with. So bipolar disorder, 58, drug disorder, 73, homeless, 77, schizophrenia, 74, depression's 38. So you can see the smoking rates are 2 to 4 times higher than they are just in the general population. And if we went over to the top socioeconomic group, I was over in the North Shore, and people without mental illness, the smoking rate would be about 10%. So the more disadvantaged people are, the higher their rates of smoking.
So basically, the Tackling Tobacco program, you're saying this is a social justice issue?
Correct, that's our message, yes.
Explain that. What do you mean?
That smoking is disproportionately affecting people in our society now who suffer various forms of disadvantage. So that could be mental illness, drug and alcohol disorders. Young single mothers smoke at extraordinary rates, about 50%. Aboriginal people smoke around 50% smoking rate. Any indicator of disadvantage you care to mention with smoking, and it drains people's money away, and it has terrible effects on their lifestyle as well as killing people.
I need to wrap up shortly because we have another panel member to come to, but tell us what help is on offer to both services who want to work through this with their clients or indeed their staff, or to individuals.
Well, I'd like to give a shameless plug to MHCC's training in smoking and mental illness. So there's a one-day free training. So Tackling Tobacco, we've got a website and I've got resources out there to assist people. And we also fund training. And we've been working with the community services, they were mentioned earlier, HASSI's, day-to-day living programs like that.
Just explain HASSI.
That's the Housing and Accommodation Support Initiative. I hope I've got the acronym right. So, if I can get it right. It's
basically housing with support, and it's been evaluated and has very high success rates in helping people improve the quality of their life and have stability.
So we've been working with programs, and we've also provided grants to programs like that to provide more assistance and get used to helping consumers with smoking and quitting smoking.
I have 2 questions. Firstly, access to aids to stop smoking, the gum, the patches. What currently is the situation? What would you like to be the situation?
The situation is there's 2 main prescription medications, and they are subsidised and they're cheaper for healthcare card holders. That's for Champix or Varenicline and bupropion or Zyban. There's issues with Champix and mental health though. And then the nicotine products, just the patch at the moment is subsidised. But people can get a script from a doctor, and it's cheaper on a healthcare card. It will cost them about $5 for a month's supply of nicotine patches. We'd like to see that extended to other types of nicotine replacement. And ideally, we'd like to see it available more freely, even without a prescription, so there's not the extra barrier of having to attend the doctor. Because this is freely available in Coles, it's just you've got to pay $30 a week or $40 a week to buy it.